So I am a palliative care physician at Our Lady of the Lake Regional Medical Center and Mary Bird Perkins-Cancer Center. We take care of patients who are suffering. We take care of patients who may or may not realize that their illness is taking a toll and that time is short. But in the hospital itself, a lot of times it's end-of-life care and family support. In the clinic, it's a little bit more walking beside that person who has cancer on their journey. So that's a typical workday prior to COVID-19. And I say prior to because the visitation policy has changed during this outbreak. So meeting in person is not as possible anymore. For me and for my team, establishing rapport is really important. And you do that really easily when you can meet somebody face to face, when you can make eye contact, when you can hold their hand. Well, that's tough when all you have is your voice. So the words that we use became ever more important. And so we had to really learn how to make a connection quickly without being in person. We wanted to be there to cheerlead and to give hope when we could, and to see people through the disease when we could. And we were able to see that sometimes, but we also wanted to be able to help them understand when we needed to hope for something different. I was consulted to see a lady who was extremely sick. She was in a separate part of the hospital. She had COVID-19. She'd been intubated for a month or so. So things were scary. Adam called me, and he was working in one of the COVID units across the hospital, and he said, I want you to know, I know that you're consulted to see that particular patient. Her husband's coming in today, and he's coming into my unit. He hasn't seen her in a month. And so we kind of were like, how can we fix this problem? And so we were like, why don't we do this? Why don't you see if you can get beds to find a bed on her unit, if possible, and let's see if we can move him from the COVID unit he's currently in to the one across the hospital where she is. And we were able to make that happen. So we got him admitted to the unit. Well, he was going to end up being down the hallway from her. We wanted him to be able to see her in person. Well, that's kind of complicated when they're supposed to be in isolation rooms. They're not supposed to leave their room. But what we ended up deciding to do was I went down to his room. We all donned PPE. About 3 of us put him in a jerry chair and wheeled him with his IV pole all the way down and got him into her room. It doesn't sound like a big deal, but to move a COVID patient from his isolation room into hers and to get him in the right unit so that he could be there with her was so meaningful for him. To at least be able to touch her hand. Those small little things, I think, make a big difference, and that takes a lot of coordination. But that's the kind of story that I will never forget, and it was such a privilege just to be a part of that. What motivates me to keep doing this is the knowledge that I'm really able to make an impact. And I think that's, at the end of the day, no matter what your job is, you want to know that what you did makes a difference. And I feel that every day. I really do. I'm lucky. I feel like I'm the luckiest doctor in this hospital because I get to come to work every day and do something that makes a huge impact in one of the hardest times in a person's life. The hardest thing for me during all of this was probably trying to balance compassion towards families and their need to be here physically with safety and the need to follow the rules that the hospital has laid out for a good reason. And I get it. There needs to be restrictions. We need to limit the amount of traffic coming in. But I also get that from the family's perspective, that doesn't seem fair. So that's been the hardest thing, is to try to balance those two really important causes. I just want to express a tremendous amount of gratitude to my team personally, but I also want to thank administration at our hospital, who I think in this situation stepped up. I would just say all of the people that don't always get recognized, the people who come in and clean out the rooms every time a patient leaves, the respiratory therapist who never get talked about enough, but those guys are in those rooms constantly. All of the nurses who stepped up and had to convert what they normally do to something different, and some of them had to learn how to be ICU nurses. So I think all of the nurses, respiratory therapists, environmental service workers, and administration for the hospital definitely deserve a tremendous amount of credit. I think it's been rewarding for me personally to be able to have participated in some way to make an impact and to be helpful.